Beautiful bill. It's a comprehensive tax and spending bill already passed by the House and now being tweaked by the Senate. The bill includes several changes, but one of the most controversial aspects of it is sweeping reform of Medicaid that imposes work requirements, reduces federal funding, and may force thousands of health insurance. Senior health correspondent Monica Robbins spoke with an economist to better explain the ripple effect of what happens and what may happen if the bill passes.
So the Congressional Budget Office is predicting 10.9 million people becoming uninsured because of the bill. I believe the Kaiser Family Foundation says in Ohio, that's going to translate to about 270,000 people becoming uninsured because of the Medicaid changes, and then probably another 170,000 people becoming uninsured in Ohio because of the ACA marketplace changes.
What might that mean for states that have already expanded Medicaid? What might it mean to the economies of those states?
I know from our local market, which is very similar to Ohio, that we have a lot of hospitals here, especially in rural areas, that are operating on pretty thin operating margins, that are not having very big profit margins and who might be struggling financially. So there has been research showing that the more uninsured people you have in the area, the more uncompensated care costs fall on the hospital. We require hospitals to treat people if they're having a medical emergency, regardless of their ability to pay. And so it's possible if there's more uninsured people, they're still going to be having heart attacks and getting in car accidents and all these horrible things that land you in the hospital. And hospitals are going to be covering that and possibly not getting compensated for that if they are uninsured.
What's your perspective of the biggest misconception the public has over this bill? Because there's a lot of rhetoric that's being, said in the media.
That's a great question. I mean, I think there are a few pieces of the discussion of Medicaid that don't totally line up with our understanding of the reality. One is that there's just rampant fraud in Medicaid, that there's lots of waste, and that this is going to clean it up. I think, unfortunately, I'm sure there is some fraud in Medicaid, just like there's some fraud in private insurance or some fraud in Medicare. But we don't really have a reason to think that it's particularly bad in Medicaid. States have a lot of programs in place to prevent fraud and to prosecute people that commit fraud. Each state is required to have a Medicaid fraud control unit that investigates fraud. That's supposed to be supported by the federal government. We do audits at the federal level of Medicaid payments every year. It's found that actually the rate of quote unquote improper payments is lower in Medicaid than it is in Medicare. So I think if one motivation for this bill is it's going to clamp down on fraud, I think it's perhaps a misconception that there's a ton of fraud that we're going to find and be able to get out of the program in the first place.
I'm being told by our hospital systems that their doctors who are on visas are now being told don't leave the country because they're afraid that they may not be able to get back in to go back to their job. So can you talk about the Medicaid enrollees and undocumented people? And then from that perspective, if this passes, what if we start losing doctors left and right because of the immigration issue?
Yeah, both great questions. So I would say first on undocumented immigrants enrolling in Medicaid, when most people think about Medicaid, they think about this state-federal partnership program. The federal government puts some money in, the states put some money in, and then the states use that money to administer the program to their population. So I just want to make it clear that undocumented immigrants are not allowed to enroll in that program that has the federal funding. Now, some states, without taking federal funding from their own budgets, have decided to create state-funded health insurance programs for some undocumented populations in their state. So there are 14 states that cover, for example, undocumented kids. So if you're a kid, you've been brought into the country by your parents and you need medical care, some states are saying, look, out of our own coffers, we're going to cover care for you. We're not getting any federal dollars. They often have the same name as Medicaid. And so it is conflated with enrollment in Medicaid, but from a funding point of view, it's actually a very different program. So these are state-funded programs or state programs. Usually kids, again, only 14 states do it, so most states don't do it at all. So I think that it's kind of important to keep that in mind when you perhaps have this misperception that there's just tons of undocumented immigrants enrolling in Medicaid and all your tax dollars are going towards it. It's actually very, very limited, and it's not anything coming from the federal government. In terms of the healthcare providers, I do think people are worried. I mean, I see that also in my profession as an economist, where there are a lot of international scholars who aren't going to do that trip home to visit their parents this year, or who are, worried about reentry, I think there is the concern that there might be more difficulties around reentry. And certainly we do have a lot of international doctors in the United States. So anything that kind of discourages them from coming and locating here and treating people could make the primary care shortage worse.
All right, Monica, thank you for that. The goal was to vote on the bill before the 4th of July, but if the Senate keeps changing items in the bill, there may be a clash with the House, and the vote may take much longer or may lose the support it currently has.